Live from Tampa Bay streaming news leader, this is ABC Action News, taking action for you.
We begin here tonight with our special coverage investigating denied insurance claims. Good evening, everyone. Welcome in here to ABC Action News at 6. I'm Paul Agrone.
And I'm Nadine Yanis. Supercomputers, robots, artificial intelligence. Science has now officially come to healthcare. In some cases, it is positive, like computer algorithms identifying certain cancers.
But many are concerned that AI, artificial intelligence, could be used to review insurance claims and that robots would deny those claims instead of humans.
I guess it's going to be on the doctors now to figure it out, to get their patients covered until AI is being used in a way where it's balanced.
I'm skeptical that that balance will ever be found, though. I think it's just going to be a continuing arms race.
So what does the AI revolution look like when it comes to companies using advancements in technology to deny you care?
ABC Action News reporter Michael Paluska had a conversation with doctors, and tonight is sharing their thoughts as our Patient No More series continues.
5, 4, 3, 2, 1, 0.
Artificial intelligence has been compared to the atomic bomb exploding into our lives with the ferocity, intrigue, and fear of the first nukes. Then, like now, we hit a tipping point, so there's no going back to the way that it was.
When you're in the middle of this sort of hype wave, you're going to see a lot of extreme opinions on each side that are just exaggerated.
And everyone wants to harness AI's power. John Liccato is an associate professor at USF, the director of the Advancing Machine and Human Reasoning Lab. He says if it hasn't already, AI will touch all aspects of life, including healthcare. Are insurance companies using AI to really kick out and deny batch claims by the hundreds of maybe thousands at one moment?
What I can say is that the technology to do it is definitely there. And the technology to auto-reject a claim is not necessarily even that sophisticated. There are lawsuits going on that accuse insurance companies of doing things like that, but you know, it's impossible to know for sure what they're actually doing. That's going to come out in the trials, hopefully.
If AI is rejecting claims, then the patient will probably have to use AI to fight the claims because the AI is so good, a human won't be able to beat it.
Yeah. And that is exactly an example of the kind of arms race that we're anticipating.
The difference with Ambient AI is it's actually more close to an intelligent human scribe.
At Tampa General Hospital, we saw artificial intelligence in action through ambient listening.
In this case, you're our fake patient, Eddie Munson.
The patient's not real, but my medical history is.
What years were your 2 melanomas?
2017. Dr. Nishit Patel simply sets the phone down, talks, and the AI does the rest. It can save doctors hours a day in administrative paperwork, and the AI nailed our conversation and removed things that weren't medically pertinent.
Literally what I said. Pretty darn good for a 5-minute quick encounter.
Doctors are in a tough spot because you put your patient care first, but you do have a lot of insurance companies that end up denying coverage, and algorithms are now being used with AI to deny certain claims.
Yeah, I think this is a really important topic. It's challenging. I think payers are trying to do their best with managing, this sort of volume of bills and authorizations that are coming through. On the same side, we're trying to do the right thing by our patients and getting authorizations for the care that the person in front of me needs. What I fear, though, is that if a payer or a health system is trying to use these tools to sort of win a battle, what we end up in is much more of an AI arms race, where frankly, nobody really wins.
Dr. Patel says a human reviews all the charts. That's not true for some insurance denials. Several states passing landmark laws to fight AI-denied insurance claims. A Florida state senator filing a similar bill this legislative session. SB 794 making it mandatory for a human to review insurance claim denials.
My initial reaction to that is I'm not sure how you'd enforce that. Right, you say, okay, a human has to review this. What's to stop them from just saying, yeah, I looked it over, right? Then you see this text that was generated here. I read that, right? It looks okay to me.
So if something gets denied, like a claim, I guess it's going to be on the doctors now to figure it out, to get their patients covered until AI is being used in a way where it's balanced.
I'm skeptical that that balance will ever be found, though. I think it's just going to be a continuing arms race. maybe you'll reach a temporary equilibrium, but some breakthrough is going to happen. Ironically, this arms race actually advances the technology, right?
Like nukes, there is no going back. In Tampa with photojournalist Josh Whitston, Michael Paluska, ABC Action News.
And here at ABC Action News, we do want to take action for you. For the last week and a half, you've seen us do that. We've been sharing your stories on insurance denials as part of our ongoing Patient No More series. A woman with a rare blood disorder was hundreds of thousands of dollars in debt due to denied coverage before her doctors stepped in. We've also heard from a group of breast cancer patients who were denied treatments, reconstructive surgeries, even mammograms. And we helped a woman clear out almost $400,000 in bills that she was left with after a treatment to keep her eyesight. And a veteran faced thousands of dollars in debt for his rehab. These are just a few of the many stories we've heard and aired so far as we've been digging into those denied insurance claims. If your doctor has prescribed treatment that your insurance company denied, we want to hear from you. Just scan that QR code up on your screen right now. Share your story with us and our I-team. And you can also read the full reporting that we've done so far and find resources to help.